Ladies and gentlemen, this is Dr. Lewis, another video again, and this is the Ultimate Channel CK. So welcome, and let's get to understand about urinary tract infection. Again, this happens to be like a disclaimer. This information is for the average person, the person who has never attended a medical class, so he cannot get to interpret anatomical words in a way that maybe doctors can. So I'm going to break down how urinary tract infection happens, the symptoms, how you diagnose it, and how you manage it, and the risk factors, in a way that a normal or an average person will get to understand. So kindly, doctors in the house, bear with me. If at all you want information about urinary tract infection, we can post a link for you. We can also provide research material for you so that you can get to read deeper and get to understand. So that's for medical school students and also those who are in the medical field and they want to understand even more about urinary tract infection. So welcome. Now, what is urinary tract infection? From the word urinary tract, that means presence of any microorganism within these organs. Now, remember, this is a structural representation or a diagrammatic representation of the kidneys and the urinary tract system. So these are the kidneys. These tubes, the two tubes that bring content from the kidneys to the bladder, are called the ureter. Then we have the bladder, which stores the urine before you dispatch it away. Then once this bladder is full, there are reflexes that happen that give you the micturition demand so that you go and urinate. Okay? So, anytime there's bacterial, viral, protozoal, or fungal infection within this urinary tract, that will cause you inflammation. Okay? And inflammation is 4 things. We say there is pain, there is swelling, there is heat, and redness. So if those 4 occur as a result of bacteria, fungi, protozoa, or viruses within this tract, then that is called a urinary tract infection. Okay? Now, on top of the kidneys, we have glands that are called adrenals. These 2 glands, their function is to produce, actually they play a very major role in urinary tract infections and immunity. Why? Because they produce a hormone called cortisol. This hormone cortisol is the stress hormone. So the more the cortisol, the more the stress you get. And the more the stress, the more the suppression of the thyroid function and the brain function and the lower immunity. So that exposes you to urinary tract infections. So sometime in future we'll make a video about cortisol and how to reduce cortisol levels, because this is a hormone that leads to even depression. Okay, and again, cortisol is produced in the morning at around 8 a.m. in the morning, and its function is counter-regulation. So it pumps glucose from the liver into your bloodstream, and that pumping of glucose into your bloodstream is in preparation for the new day. And remember, glucose is a good source or a good culture or food for bacterial growth and fungal growth. Okay, and that's why in the general management of urinary tract infections and prevention, we'll talk about sugar. So now we've defined it. So now we want to classify urinary tract infections. How do you classify it? Now, urinary tract infections are classified according to the level at which the infection has spread. Now, we have this difference. So you can classify them into upper and lower urinary tract infections. That is 1. Number 2, you can classify them into complicated and non-complicated. So upper affect the kidneys and the part of the ureters. So they cause inflammation in the kidney walls and part of the ureters in a disease called maybe pyelonephritis or acute kidney injury. And the lower ones affect the lower part of the ureter, the bladder, and the urethra, and even the penis and vagina. So that is the first classification, upper and lower. The second classification is complicated and non-complicated. As the word suggests, complicated means possibly there was a relapse, a recurrence, or infection, and this has become a little difficult to manage. So it requires a specialist, a urologist, or a nephrologist that will help us identify the real cause and the management. Now, the uncomplicated one are the ones that you show symptoms all the time. Most of us have, some of you have experienced urinary tract infections and you know the symptoms. And those mild symptoms are the ones for the uncomplicated conditions. Now, as we still classify the two, there are three words that I want us to clarify. Number one is recurrence. So, we have recurrence, we have reinfection, and we have relapse. What is the difference? So, recurrence means you have this infection, you've managed it, and then it reoccurs. The same infection reoccurs within 12 months of treatment. So you treated it, then within 0 to 12 months, the infection reoccurs. That is recurrence. Now, reinfection, this is a different infection completely. So maybe the first time you had a bacterial infection, and this time you've come with a fungal or viral infection, which you've gotten from elsewhere. Now that makes a reinfection. And the relapse, the last one, is the recurrence of the same infection, but within 2 weeks of treatment. So you've been managed today, you take 2 weeks antibiotic therapy, you get better, and then again, you come back after those 2 weeks with another condition of the same species. So those are the three words I wanted to clear. Now after that, how does this process come to occur? So remember, we have the vagina and the penis down here. Then up here we have the kidneys. So one, we have blood vessels that supply the kidney. These are called the renal blood vessels. So renal artery and renal veins. They supply the kidneys with nutrients through oxygen and oxygen through blood. And lining these blood vessels is a system that is called the lymphatic system. Now the lymphatic system is basically the system that has all the immune cells. It doesn't have blood, it has all the immune cells and fat, and its function is to transport fat and to protect your body because it has white blood cells which function to protect your body. So it lines along the blood cells, the blood vessels. So remember, now we have blood vessels bringing blood into the kidneys, and we also have a lymphatic system which takes the filtrate from the blood. So that gives us a leeway to understand the two forms or the two processes under which urinary tract infections occur. Number one, we have blood spread. So anything that comes through blood, you have sepsis. You have a high content of bacteria in your blood or viruses in your blood, and they get access to your kidneys and they start causing kidney infection, whether complicated or not complicated. That is number one. That is called blood transmission or blood process and spread. Number two, we have the lymphatic spread. So lining the blood vessel, we have the lymphatic system. Again, remember its function is to fight infections. So sometimes we have high content of microorganisms in this lymphatic system that get access to your kidneys and even your urethra and the bladder. So the entire system, and they cause infection and inflammation. That is the lymphatic spread. So these two are the descending. Now, the one that comes from down to up, that is the ascending. Okay? So the ascending one comes from your urethra into the bladder and spreads higher depending on how you manage. It can spread to the kidneys also, depending if you've managed it earlier and then it disappears. If you don't manage it earlier and don't identify it earlier, it spreads and even affects the kidneys. So you can get acute kidney infection or even chronic kidney failure. And remember, kidneys play a big role in salt balance, electrolyte balance, hypertension, balance of hypertension, and even acid balance. So if you affect your kidneys, then your system starts to fail. Okay, because again your liver will start to fail, and your brain, and this becomes a multi-organ failure, and you die. So don't take it so lightly. Now, so those are the three processes. The fourth process is where you have an inflamed pelvic. So your kidneys are right here. Now, below is the pelvic girdle. That pelvic girdle can contain something called PID, pelvic inflammatory disease. This pelvic inflammatory disease is the inflammation of that pelvic girdle due to bacteria, virus, or fungal, and it's so painful. The symptoms are so painful. Women will tell you that they feel abdominal pains, painful cramping, back pains, and sometimes urinary urgency. They feel like going to urinate. Once you go to the toilet, there's nothing. And these are the same symptoms that will occur in uncomplicated and complicated urinary tract infection. So that one is the ascending spread. So good. So we have four. We have the blood, we have the lymphatic, we have the direct spread from other organs, like the pelvic. Then we have the they're ascending, which is from the urethra upwards. So now that you know that, so once you experience symptoms, so what are the symptoms that you'll experience before you go to the hospital and get diagnosed, or maybe before you visit a pharmacy and buy those antibiotics that we buy without consideration of diagnosis? So once you start feeling these symptoms, those are abdominal pains, those are the fevers and chills, depending on the level of infection, because the infection is in blood and the lymph, you'll feel all these chills and fevers because the body is trying to fight the infection through the lymphatic system. You'll also feel back pains, you'll also feel abdominal bloating, and even nausea and vomiting. Some people get the vomitings. And you cannot, sometimes they cannot hold urine because this infection creates a difference in the reflex of urination. So you have urine but you cannot urinate, or you don't have urine but you have the feeling of urinating. So that urgency. Again, inflammation of the bladder, which is called cystitis, can happen because of this infection. Also inflammation of the kidneys, and this will cause blood in your urine. So all these are the symptoms of urinary tract infections. Itching, these are just mild symptoms that occur on the skin. Itching, redness, those rashes, and sometimes foul bacteria. If bacteria is present, there's foul smell and pus cells and all this, and frothy urine. Okay, so once you have all these symptoms, it's advisable that you go to the hospital. Once you go to the hospital, possibly you need a diagnosis before you start management. You cannot take antibiotics unless prescribed if you've not had a proper diagnosis. Now, proper diagnosis, I'm talking about microscopy. So microscopy is the standard, is the gold standard for diagnosis, because it will tell you the number of pus cells or the bacteria and the type, even the type of cells that are available. So you'll understand, you get to know if it's a fungal infection, you can target fungal infection directly by antifungals. If it's a bacterial infection, you can target the bacteria by giving broad spectrum or even narrow spectrum antibiotics depending on the bacteria. And an antibiotic therapy for around 14 days is enough, unless there is a reinfection or a relapse. Okay? That's when you send to a urologist or a nephrologist for further investigations. So number 2, we have urinalysis. The problem with urinalysis, it doesn't show you, you only compare the strip with the colors available for urinalysis strips. Okay, so it only shows you if you have an infection, but it doesn't classify this infection or give you the amount of extent at which the bacterial infection or the infection has spread. Number 3, you can do a urine culture. Urine culture is the one that is done to show if you are resistant to any antibiotics, or if the bacteria that you have already is resistant to drugs, so that we can understand which drugs to prescribe again. Then the last one is CT and MRI. These are scans that possibly will show if there's a problem in the kidneys or your urinary tract system. So those are the diagnostic techniques that are available for this. I'm not saying there are no more. I'm just saying these are the main ones that you can use to diagnose any condition or any infection that happens or occurs in the urinary tract. Then, now once you've diagnosed it, then now you get the results. Once you have the results, now you can go for the treatment. And what are the aims of treatment? Because you cannot just treat an infection without having a goal. So the aims of treating urinary tract infection, one is to protect our kidneys and other organs, because our kidneys play a very large role in our bodies. So we have to protect them by all means. If you let them just get the infection, we might have problems in future. Okay, so protect the kidneys, protect all other organs. Number 2, you relieve the symptoms. We want to suppress all these symptoms so that the patient feels comfortable, okay, or the client feels comfortable. Number 3, you eliminate the infection completely, and chances of relapse and reinfection. So that's where we fail so much, because we don't give so much information to the patients about how to use these drugs and if the partners are supposed to be treated also. Okay, and even pregnant women, we don't give them adequate information. And the last one is to prevent this reoccurrence, reinfection and relapse. So those are the goals of treatment. Now, we already said, if you've identified that the infection that is here is a bacterial infection, you go straight to antibiotic therapy for 7 to 14 days. That is enough. Do not treat asymptomatic patients. Patients who don't show symptoms, you don't treat them. And again, these patients will not come to hospital because they don't see the symptoms. Most patients come to hospital when the infection is already profound. Okay, so but do not manage uncomplicated infection unless it's in pregnancy and there's a risk that this one will bring problems like abortion and miscarriages. Yeah, yeah. Number two, if at all this patient has come maybe to your pharmacy and you want to give drugs, but you don't have the diagnosis because some of them don't have time and don't want to take the advice to go for diagnostics. So what do you do? Sometimes the pharmaceutical industry became a little sharper. So it provided you with the machine gun therapy. Drugs that have 3 combinations of the combination therapy that targets both bacteria, fungal, and viruses, even protozoa. So these drugs are available in the market and you can use them, though they are expensive. So we prefer prevention more than using drugs and cure. But once it gets to worse, you'll have to go for the drugs. Again, if it's complicated, consult a neurologist or a nephrologist so that you are helped. So those are the specialists who will help you handle these conditions that are complicated. Now that we have heard that, so those are therapeutics. So those are drugs. Now, what are the things that you can do to avoid urinary tract infections? And remember, here, there are 2 things I forgot. 1, babies from 0 to 6 months, the ratio at which they get infection, urinary tract infection, is around 2 to 1,000. That means two babies out of 1,000 will get this infection. Why? Simple reason, breast milk. So breast milk has all the antibodies that can fight urinary tract infections in babies. Okay, so before you go for that diagnosis, make sure you breastfeed your baby exclusively for 6 months. And breastfeeding starts when you're pregnant. So there are foods that we already provided for pregnant women, and we still say just avoid sugar, avoid simple carbohydrates, avoid pasteurized milk, avoid the use of yogurt to clean your genitals. It doesn't work because yogurt is already pasteurized and there's limited lactic acid there and bacteria, lactobacillus. Okay, so you can consume fermented cabbage, which has lactic acid, and we talked about it. It raises the pH of oil, lowers the pH of the vagina and maintains it, and that is enough to kill bad bacteria. Now, number 2, it also has good bacteria that will balance the ratio between bad and good bacteria, so they will die. So again, avoid sugar, avoid simple carbohydrates, avoid alcohol and smoking, avoid MSG. MSG is a component that is found in margarine, and it's highly inflammatory. Avoid seed oils. So these are the things that will mess your immunity. Once they mess your immunity and it goes down, then your chances of getting urinary tract infections go higher. Then eat healthy foods, eat seafoods, eat complex carbohydrates, fiber in plenty. Reduce your insulin hormone by all those processes that we've kept preaching. And you will be fine. So yeah, anything you want to clarify, kindly ask in the comments. We will be clear to put it to you. So thank you for that. We'll see you again in the next one.